Go.
Hi, I'm B. I work here with Dr. Dadvand, and we get a lot of inquiries regarding male to female top surgery, so I'm just going to ask him a couple of common questions that we get. Who would be the ideal candidate for male to female surgery?
So the best candidate for this surgery, and really for any transitional surgery, is someone who's not at the beginning of their transition, but towards the middle, towards the end. So I prefer patients to have been in with a therapist and under a therapist's care. I really want them to be on hormones, and that's a little bit different than female to male top surgeries. But the male to females, I really do require them to be on that. But that they've been transitioning in other ways of their life for some period of time before they actually undergo a surgical procedure.
Okay, and that actually ties in with our second question. Is there any pre-treatment before surgery?
So for top surgery in male to female patients, I absolutely require them to be on estrogen for as little as 12 months and up to 18 months. Estrogen has some really beneficial effects to making a successful surgery, and that is that it naturally increases the breast tissue growth that the patient develops. But it also makes the pectoralis muscle more pliable and a little bit more supple. And both of these things lend themselves to having a much better outcome when doing breast augmentation surgery with implants in these patients. So definitely being on estrogen therapy for at least 12 to 18 months. But it's not even just so much the time that they're on it, but I want them to get a breast growth and then a stabilization of that breast growth where it's not continuing to increase for probably another 3 months before we do the surgery.
Okay. What is the recovery like for this surgery?
So I get this question with almost every surgery that I do, and the way that I look at recovery is two ways. It's recovery to get back to work, and then recovery to get back to the gym or exercise, that sort of thing. For work, most patients back to work within 1 week. Don't need to be taking off more than that unless your job is really active and involves a lot of upper body work and heavy lifting. But most people, if you're working in an office situation, you're back to work within 5 to 7 days. Now, as far as going back to the gym and physical activity, I want people to hold off on that sort of stuff for about 4 to 6 weeks. And everybody's a little bit different, that's why I give that range. But most people are ready to get back to some working out after about 4 weeks. But you can certainly walk as much as you like in that first 4 weeks, but nothing too strenuous and definitely not a lot of upper body stuff.
Okay. Is there any other procedures that can complement top surgery?
Yeah, so I think that's the way that I look at patients and their form is as a whole. You know, the breasts are one thing, but there are other features that make someone look more feminine or more masculine. And so it's one of the things that I typically do is, in addition to doing the breast augmentation, do liposuction, and liposuction with sometimes fat transfer to the hips, something to create a less straight up and down silhouette into a curvier silhouette. And that really also has a lot to do with the patient and what their aesthetic goals are as well. But there certainly are complementary procedures that can be done at the same time.
Okay, and last question. What advice would you give to someone going through the transition?
So the one thing that I always say is, look, surgery is definitely an important part of the transition process, but it shouldn't be the first step. I want patients to be starting on their transition and doing the other things along the transition, and then using the surgery to kind of finalize that transition process. It's definitely not something that should be done in the beginning of the transition process, but somewhere more towards the middle to the end. And it's one of the most satisfying surgeries that I do. It's to be able to really impact these patients' lives with this surgery and get them to finally feel feminine on the outside, how they've always kind of felt on the inside. It's really a privilege. If you have any comments or questions that you want me to specifically address, even in future videos, please feel free to leave the comments below. I'd be happy to answer them.
And follow us on IG as well. Our IG is at DadvandMD, DADVANDMD. Thank you guys for watching.
Bye guys.